HPV stands for human papillomavirus. It consists of approximately 150 viruses that can cause a variety of problems in the anal and genital area. The most common problems caused by HPV include anal warts. However, patients can also have problems with anal precancer and anal cancer. HPV virus infection is also associated with the development of warts in the vaginal and cervical area in women. HPV virus is also known to cause cervical precancer and cervical cancer in females. Therefore, if you are a female who have had a diagnosis of HPV on a cervical pap smear or in the vagina, you should definitely seek care with a colorectal surgeon to have a routine examination, even if you are not having symptoms. HPV is a sexually transmitted disease that can be transmitted through oral, anal, and vaginal intercourse. However, HPV can also be spread through skin-to-skin contact. HPV is very common, and most people are exposed to HPV at some point in their lives. HPV infection can lead to a variety of problems in and around the anal area. The most common problems are anal warts. However, patients can also present with anal precancer as well as anal cancer. It is important to remember, however, that many patients have no signs and symptoms at all when they present to a doctor with HPV infection. Anal warts are caused by HPV virus, and these are referred to as condyloma acuminatum. They can present as raised areas around the perianal area. They also commonly can occur inside the anus. They can present with symptoms such as itching, bleeding, irritation, and mucus discharge. AIN is a precancerous lesion in the perianal and anal area. Again, this is caused by HPV virus. However, sometimes patients may have internal lesions that are causing no symptoms at all. Anal cancer is also caused by human papillomavirus. It frequently presents with anal pain, bleeding, and a raised lump or bump in the anal area. You can also present with problems with change in bowel habits or fecal incontinence. It is very important that you seek the care of a colorectal surgeon if you have these symptoms, as many patients will ignore these symptoms and blame it on a simple hemorrhoid. HPV is diagnosed by an examination by your doctor in the office. This will include examination of the perianal skin as well as a rectal exam. This is not a painful examination. If lesions are seen, they may be biopsied in the office. Occasionally, patients will have an examination in the operating room and also have biopsies and a treatment. Another thing that can be done in patients who have HPV is an anal pap smear. This is done by inserting a small swab into the anus and taking a sampling of the cells in the anal canal. Ways to prevent HPV infection include the following. Do not have sexual contact with people who have anal or genital warts. Limit sexual contact to a single partner. Abstinence requires not having any sexual contact. Always use a condom. Sexual partners should also be checked for HPV and other sexually transmitted diseases, even if there are no symptoms. Vaccination with the HPV vaccine is also recommended in men and women under the age of 26 to prevent infection. Patients with HPV virus infection are at risk of developing anal cancer and precancer. Because of this, once you have had a diagnosis of HPV infection, it is very important to have close follow-up with your colorectal surgeon. Warts in the anal area can be treated various ways. External lesions can be treated sometimes with topical medications. However, extensive anal warts that are external frequently need to be addressed in the operating room. Internal warts need to frequently be treated in the operating room. If you have been diagnosed with anal precancer, again, frequently a trip to the operating room is necessary to treat these lesions. Again, the most important thing is close follow-up with your doctor even after this treatment has occurred. If you have been diagnosed with anal cancer, then this would be managed in a different way, frequently with chemotherapy and radiation. Treatment of condyloma and AIN may prevent the progression to anal cancer. However, very close follow-up is needed because these lesions are frequently recurrent. Overall, the risk of developing anal cancer remains low in patients who have a diagnosis of HPV. And in fact, there are certain populations of patients that have an even higher risk of developing anal cancer if they have a diagnosis of HPV lesions. These higher risk patients include patients who have HIV, also patients who are immune suppressed for any reason due to medications. Also, women who have had a diagnosis of cervical cancer and precancer are at an increased risk. Also, any patient who has had a history of anal intercourse and men who have sex with men are at an increased risk of developing anal cancer, even if there is not a diagnosis of HIV. Because of the increased risk of developing anal precancer and cancer, close surveillance with a colorectal surgeon is paramount. Also, if anal cancer is diagnosed at an early stage, it is often very curable.